Hey everyone, this is an introductory lesson to ECG. So in this lesson we're going to specifically talk about Einthoven's triangle and ECG lead placement. And we're specifically going to talk about limb leads, augmented leads, and precordial leads. So Einthoven's triangle is formed by lead placement. So the leads are placed on the right arm, the left arm, and the left leg or the left foot. So what happens is we can form three leads from Einthoven's triangle. The first one is from the right arm to the left arm. So a negative electrode on the right arm going toward a positive electrode in the left arm. So that's lead one. The lead two goes from the right arm to the left foot. And that again is a negative lead on the right arm going to a positive lead on the left foot. And the third lead is from the left arm to the left foot. So a negative lead from the left arm to a positive in the left foot. So these are the three leads from Einthoven's triangle. And you can remember the placement of these just by thinking of this triangle and by thinking it goes in a counterclockwise motion. So lead 1, lead 2, and lead 3. Again, lead 1, right arm, negative, going toward the positive in left arm. Lead 2 going from a negative in the right arm down toward a positive in the left foot. And lead 3 going from a negative in the right arm going toward the left leg or the left foot with lead 3. We can also derive what we call augmented leads. And augmented leads include AVF. So F, you can remember, for foot. That lead points toward the foot, so the positive direction points toward the foot. AVR is another one, and this one you can remember by AVR for right arm. So this lead has a positive, it points toward the positive lead in the right arm. And AVL, L for left arm, is the other augmented lead, and this has a positive pointing toward the left arm. So it's all about negatives and positives with these leads. So with regards to the augmented leads, you can remember the positive electrode by the basically what the lead is called. If it's AVR, it's R for right, and the right arm acts as the positive electrode in this case. If it's AVL, L for left arm, the left arm acts as the positive electrode. And with regards to AVF, F is for foot, it points toward the foot. The foot, left foot particularly, acts as the positive electrode. So this is how we can remember how these leads and augmented leads function. So we're going to go a bit more into detail with regards to these. So lead 1, 2, and 3 are known as the limb leads. So again, lead 1 is from the right arm, which acts as negative, toward the left arm, which acts as the positive. Lead 2 is from the right arm to the left leg. Right arm is negative, left arm is positive. So the current goes toward the positive, goes toward the left leg. And lead 3 is the left arm acting as the negative electrode, pointing toward the left leg, which acts as the positive electrode. Now, with regards to the augmented leads, we talked about these before. AVF points toward a positive lead in the foot, F for foot. AVL is toward the left arm, so L for left arm, and where it points to is the positive electrode. And AVR is R for right arm, which the right arm acts as the positive electrode. So what does this all mean? If we have kind of this basic understanding of lead placement, where the leads are pointing positive or negative, or what does this all mean? Well, we got to think about it in the context of the heart itself and how the heart actually depolarizes during contraction. So if we were to look directly onto a patient, like in this image here, this is the right side of the patient, this is the left side of the patient. If we were to look directly on, in normal, healthy patients, generally speaking, the heart will depolarize from the right upper area of the heart, so the SA node, down toward the left lower area of the heart. That is the mean vector of depolarization, goes in this direction. So we've talked about how, say, lead 2 points with a positive direction going from the right arm to the left leg. Well, that's basically in the same direction as how the heart normally depolarizes, as you can see here. So the heart depolarizes down toward the lower left, and that also is the same as lead 2. So because these two currents, or these two vectors, are going in the same direction, lead 2 will have a higher inflection, and we're going to talk a bit more about that a little bit later. So this is generally a summary of what we talked about in the last slide. We have AVR with a positive going toward the right arm, AVL with a positive going toward the left arm, and we have AVF going toward the left leg, and we have lead 1 from the right arm to the left arm, lead 2 going from the right arm to the left leg, and lead 3 going from the left arm to the left leg. So these are the general degrees of change. We also have what we call precordial leads, and precordial leads it's difficult to show in an image here because this is a two-dimensional image, but precordial leads actually project out. So they actually, you can imagine these red lines here projecting out of the screen toward you. So V1 projects out toward you, not in the same plane as lead 3, but it's actually projecting out of the image perpendicular to the rest of the other vectors. So the precordial leads are perpendicular to the other leads we talked about before. So V1, V2, V3, V4, V5, and V6 are all the precordial leads. And again, they are all projecting out perpendicular to the other leads, the limb leads and the augmented leads. So these leads are essentially projecting out toward you. And to go over this one more time, the limb leads and the augmented leads, so lead 1, lead 2, lead 3, and AVR, AVL, and AVF are in the plane of the screen. And then the precordial leads, V1, V2, V3, V4, V5, V6, are perpendicular to those limb leads and the augmented leads, so they actually point out of the screen toward you. And V1 to V6 goes from the right side of the patient to the left side of the patient. So V1, V2, V3, V4, V5, and V6 are again from the right side of the patient to the left side of the patient, pointing out of the screen toward you, so perpendicular to those other leads we talked about before, the limb leads and the augmented leads. When we look at the leads we've talked about so far, it's all about degrees. So we can start with lead 1, and lead 1 is considered 0 degrees. And going counterclockwise goes negative, so you get a negative degree number. So AVL would be negative 30 degrees, AVR would be negative 50 degrees. And if you go clockwise from lead 1, it's all positive numbers, positive degree numbers. So lead 2 is positive 60 degrees, AVF is positive 90 degrees, and lead 3 is positive 120 degrees. So these are all important numbers to kind of keep in mind as well. And on the opposite end to lead 1 is 180 degrees. So the leads that you should remember the degrees for include lead 1, which is 0 degrees, lead 2, which is 60 degrees, and lead 3, which is 120 degrees. That's pretty easy, 0, 60, and 120. You can also remember AVF as 90 degrees. So those are pretty easy degrees to remember. And again, all of these limb leads and augmented leads are in the plane of the screen, whereas the precordial leads point out of the screen at you. So again, lead 1 is considered the set point, it's 0 degrees. And then if we go counterclockwise to lead 1, it's negative degrees. So AVL is again negative 30 degrees, AVR is negative 150 degrees, and then clockwise to lead 1 are the positive degrees. Lead 2 is 60 degrees, AVF is 90 degrees, and lead 3 is 120 degrees. And again, out of all of these leads, think about lead 2 as particularly important because the mean vector of depolarization of the heart generally points in the same direction as lead 2 at 60 degrees. So think about looking at lead 2 as an important landmark to remember. So if you want to learn more about ECG paper, the PQRST wave, what all the waves mean, and how we can actually have a method of looking through an ECG, please check out my other introductory lesson to ECGs. If you found this lesson helpful, please consider liking, subscribing, and clicking the notification bell to help support the channel. And as always, thank you so much for watching, and I hope to see you next time.